honor the Texas flag, I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Is there any public comment to be said today? There being none, I'll proceed to number 4, discussion possible action on budget amendments. And there's some that we mentioned, and I hadn't got a copy of the new budget that we adopted, but I wanted to make sure that we're okay on all the nonprofits that we have. Can you? Can you? Wait a minute, the nonprofits. I know Ms. Martinez is working with the chamber on what can be done and what can't be done. So, and the others were taken care of. The other thing in Salle at the center, bringing your individuals to the county, you know, and pay them to the county, do a budget amendment, bring them over here to us. And there's 2 people working, a husband and a wife, and the husband's always helping him. You know, bring him in part-time. He's been doing it for 10 years, 15 years. It's out of the budget, it frees up, but he's really helping he's doing nutrition center stuff. And it frees you up some money. You know, and make that budget amendment to bring them over.
And put them under your vision?
No, put them under Damiana, because that's what they've been doing for a long time. They were there when the old center was there, and they're there now, and the lady works and the husband helps her, but the husband doesn't get paid. I mean, so leave it part-time, do the budget amendment, and let, you know.
They also clean, you know, around the park and.
And it saves you that money, out of your budget as well. But you're the only one paying for people that are not road and bridge.
Well, I was gonna ask for someone too. Once we build that dialysis and the nutrition center, I want to put somebody just for that.
For what?
The maintenance right there. Instead of having Robert doing all that. Because that's too much for Robert.
Well,
They're currently sweet spot
Well,
right now.
the dialysis is not open yet, and it's what we negotiate in the contract. And that's where you control the contract. So we can't put something in there where we don't even have a budget line item.
Yeah, but
But where is the budget, but there's no budget line item on that. Over here, they're already working, they're already there, we're talking about opening it up, and we got time, but we gotta get that contract done first. You know, I'm okay with bringing someone to do maintenance of that building or whatever, but I think the owner or of the operation is gonna have something to say with that.
well, a lot of times you do it that way, and it doesn't like the nursing home. You know, it looks terrible all back.
I mean, if you want it, put it on the agenda. If you want to put it on the agenda, then we'll do it.
I'm just saying it because you know how the nursing home looked a while back, about 6-7 months ago. All the trees were dying and everything. Is that what you want to do, the regular dialysis?
Look, that's not on the agenda. We have budget amendments, and there's only
know it's
things
not.
that.
I'm just saying that.
But then it's a violation of the Open Meetings Act. That's why I said put it in writing and we get it. But you're fighting something that's not on the agenda. It's, for example, they do the rodeo. It has to be a nonprofit. It has to be public purpose that we give. Well, I want to make sure the money's there, but they got to do what they have to do. They got to do their part. You can't just give money away for a vote. It has to show something for the county. And you're road and bridge commissioners, and yes, you do budget, but you don't have oversight and the ability to force anybody else in this office what to do. We can't.
Okay, we're talking about in Salle. All the tables, after they have a party, who's supposed to pick all that up?
Well, after they have a party, if those people have a deposit, then it gets lost. That's gonna be up to Robert to do the job. It's gonna be up to Robert to follow up with them.
That's one of the tables right there, I don't know if you can see it from over there. That's one of the chairs, all broken, and who took care of that?
But this is the thing, we put that under, they rent it to Robert, and they do the deposit. Then he has to put someone to come down and look at it after. But right now, we're covering budget amendments. You have a lot on your mind. Put it down and we'll put it on the agenda. But if someone's gonna operate the center over there, when we finish the contract, we cover part of it, maintenance inside, and who's gonna do it. And then you can hire somebody. But your only direct employment opportunity as any of your commissioners are the ones that you work under you, unless we come together and hire somebody together if the law permits. And I know it's frustrating because people get after you, haz esto, haz otro, but sometimes
They
you
don't tell me
can't.
to do it, I just see everything.
Huh?
I just see everything. They don't tell me, I can see.
No, you don't see everything because someone sent you that picture.
I went all the way over there, Judge.
So if you went all the way over there to do it, and there's commissioner, who told you to go over there to go look at it after the thing?
Look at all the lamina. Look at all the tin they took off the roof.
Yeah.
What are we gonna do with it? Stacked over there? What do we do with it? There's a lot of it. Commissioner Ayala wants to do something here. There's a lot of it, look at all that. Now, did anybody got the pictures? Did anybody took time to go take the pictures? No? I did.
This is the thing. We got a contract with a company. And in the contract, you usually say, they dispose of material, they become theirs, or they become ours. And we put the contract, we decided we wanted it.
Yes, sir?
We wanted it, and that's why it's there. So you all want it for some reason, it can't be given away sold. But that's not on the agenda right now. It's
But
not on the
I mean,
agenda.
I look at everything, Judge.
And it's good to look at it, but there's a proper way to do it. There's a proper way to do it. And there's a process to do it. And one of the very first things that I did when I came in as county judge, I set up what they call rules of decorum. And I don't know if they were back there, but every single commissioner and myself have the right to put something on the agenda without question. It doesn't require two signatures, just on your own. So it's easy to do so. And I know some of this is frustrating because apparently people are opening it up to you, it's good. And if they open up to you, then we'll bring it through and put it on the agenda and address it. But right now, we just wanted to cover the budget amendments to make sure that they were there. And then if you want, I'll put the refunds of the facility, because if they tear it up, someone's responsible for them. They didn't clean up, someone's responsible for them. You know, in the budget amendment, I wanted to bring them over, because they've been in Road Bridge for a long time, and we've been getting two for the price of one. And they're elderly people, but they've already been there 10 or 12 years, maybe longer, to do it.
I think they're up in that area.
And, I mean, they stay active, but they're not gonna work as fast as a 20-year-old. They're not. But how can you also take in the budget amendment that they've worked all these years and say, you know what? Oh, we can get somebody younger, push them out. We can't. You know, they might work 2 years, 3 years. I don't see too many years on that, but I think we should be fair. We should be fair. But there are things that happen that people report to you, and sometimes you want to take care of it, and it frustrates you because it seems there's a way of handling it, and you know, we can address it. Because I mean, people tell me, you know, some things, and then they get upset because I don't do anything about it, but some of it's not mine to make a decision, especially when it comes to law enforcement. There's a process. There's a process that only I can do certain things and some things I can't. Together we can do a lot.
Make a motion to approve the two part-time employees for the 1800 Treatment Center.
to be moved to,
Part-time?
the part-time out of, move to the parks.
They're gonna,
They'll still be doing the same
they'll be
thing, but it'll be free on your budget.
yeah, they'll respond to
Robert, Damiana, as long as they work with them,
both home there and the,
as long as they continue working with them there. Yeah. It just cleans that up.
like that it's on the budget amendment. When I know he had applied,
Well, I mean, we'll do it, as soon as Jorge gets it done.
Now, on that, just, I mean, you already made the motion. Are they in good health, or how is his health before you hire him? I mean,
Well, we're doing the budget amendment, and then I guess Robert can do the hiring and figure out what it's there. He's already been working, and they're not looking for full-time, part-time, so the health is not gonna matter. They're not gonna get benefits. They're not gonna get benefits. So it's just gonna be part-time. They may get retirement, a little bit of retirement, but that's gonna be it.
30 hours,
Huh?
30 hours.
Something like that.
you know, if they put in like 5 hours a day.
But right now, just the budget amendment, and then do the, you know, the application, and it'll go to Robert.
Is there a second?
me too.
Second.
Okay, we're gonna have a couple more of these on this line item. All those in favor, say aye. Then, I wanna make sure we're okay on the library. Are you here for the library, Nora? I mean, was anybody here for the library? The library?
I guess they don't want anything.
No, I mean, they cover it. My glasses get clogged up. Clogged up. I wanted to go up 5,000 on the Catula Historical Commission. And the Historical Commission is really ours. It really is ours. We appoint the board members, you know, property belongs to the county, and they're the only ones that we have not increased, and they continue to do, you know, a lot of things. But before you do motions, do that 5,000. And I know the chamber wants 40,000, but they need to work it out with Martinez and come up with a plan for us. So I don't know if there's anything on the chamber yet, Mr. Flores. Nothing yet, right?
Did we get the chamber last year?
No?
No?
No. What happens on the chamber, the law says is that the county cannot be a member of the chamber. We cannot be a member. And if we do a project, it has to be for economic development, and they have to let us know what economic development is. The same thing for the rodeo, the Fair Association. It has to be economic development or health and safety. So there's ways, but they gotta give us a proposal. They can't just ask for 40,000 and not give us a reason what they're using this money for. They gotta ask for 40,000, ask us, these are the programs we're gonna do. So, and as we learn some of these, you know, we'll bring it because up to about 3 years ago, the chamber never asked for money. Because, you know, unless they hit these conditions, they can't get it. And
So what do the chamber do?
what?
What do they do, chamber?
The chamber is to propose local growth and development for all businesses. They're supposed to try to encourage business shop locally, develop locally, network them to where they have, they can attract other businesses to come to Cotula. So when we say economic development is, okay, you're gonna have a program to where we're gonna advertise, that so-and-so is really famous and we're gonna help promote that person so people will stop in Cotula. Whether it's gas or hotel or, you know, the city of Cotula in there, the Civic Center has a room that's empty. And they were supposed to set up a museum according to the Parks and Wildlife, a small museum. So they could set a mobile museum, you know, this year we're gonna do it on Phil Lyon, this year on Haley, this year we're gonna do it on another famous person, to where you encourage people to stop as part of the Chamber of Commerce, you know, and visit or something. You try to get people to stop here. So that's the plan. It's not asking too much, but it's saying, let's have a plan. If you get money from the county, show us your plan on how it's gonna help us. It makes us all look good.
They stop just one time, they don't stop twice.
Well, even if they stop one time, it's okay, but I'm saying, these are just some examples that you do.
You know what's real nice? I mean, I know it's not in the agenda, but that park right there, the rest area in Patricia, that is something you stop just to look at it. It's nice.
That stop in Artesia was county land.
I know it says the South County, but
Yeah, but we donated the land, it belonged to the county,
real, it's awesome.
in 2004 or 5. So, we got the Cotula Cemetery okay here. And Cristo Rey, we're supposed to put money, so we got some money there. I don't know if you see anything else. I don't know if anybody else wanted budget amendments to transfer. Jorge said, George Trigo wanted some budget amendments, he hadn't got them to me. I don't know if he got them to you.
No.
So there's not gonna be that many, for now, so this is gonna be going up $5,000 on the South County Historical Commission. So we would need one more, or we can wait and let me hear from everybody else, give them one more chance. But I'd rather take care of it now than it continue to go on and on and on and on throughout the year. So if that's the case, I'll leave it alone on the local historic commission and then we'll just move to the next item. Next two items. Discussion on county leave policy and approve any necessary changes, and discussion and or possible action on COVID-19 testing. Gilbert, do you have a copy of the new law? I know Danny had it.
Yes, sir.
There's a law that kicked in last year in the Texas legislature that says your first responders, being people holding a license in either medical or law enforcement, that if they get sick, which like might be COVID, that they don't have to use up their sick leave or their vacation. We have to pay them. Only them. I guess the people, it might be, it's just first responders.
Just, it details, it's firefighters, EMTs, peace officers, and detention officers. So all the jailers.
But they gotta be vaccinated.
No,
They have to be vaccinated.
No,
No.
and it's not just, it just says virus.
there's two parts of this. There's two parts of this. This was passed by the Texas legislature that says if you're one of these people and you get sick, then you gotta get paid. Now, there's another law that's kicking in on the 9th of January, and it states that any employer over 100, which one, that has federal contracts or does federal business, which we do, Medicaid, Medicare, and we got the prison contracts, must have all employees vaccinated, and if they're not vaccinated, those employees would have to get tested weekly, and that could be at their expense. And what's gonna have to happen is that Mary's gonna have to have access to everybody's immunization through the state or through your records to determine who's vaccinated or not. Because after February 9th, any employer that is not complying can be fined up to $14,000 a day. There's one more action. It went to the Court of Appeals. It may be reversed in the Supreme Court, but for now, it's still active. For now, it's still active. So we don't have a say on that.
Judge, when you say vaccinated, does that mean booster also?
Everything. If by January 10, 2022, employers should be able to track employees' vaccination status, create a database detailing vaccination information for each employee, require unvaccinated employees to wear a mask, provide paid time off for employees to get vaccinated. As of February 9, 2022, employers must require unvaccinated employees to test for COVID weekly. In this regard, self-administration or self-read tests will not comply. Employers must observe or use a proctor and have employees tested on-site or a recognized testing facility. And we are required to give reasonable accommodations to workers with medical conditions that are unable to get the vaccine. So we do realize that there's ADA, and if so, they're probably gonna have to be tested, you know, if they can't take the test. So, employees will need to have either 2 doses of Pfizer or Moderna or 1 dose of Johnson & Johnson by January 10th deadline, though there is a grace period to allow for compliance. So the grace period would be by February 9th.
And unfortunately, the way that one was written, the CDC guidance has changed as of the 7th? No, not as of today. Let me see in this email. 12/29 is when the CDC guidance changed on fully vaccinated and partially vaccinated individuals.
So one is, when you test, like you tested people, then Mary, Willie are gonna need to know who didn't test, because those people need to get tested. And some employees said they've tested, but they haven't provided the paperwork or the email confirmation that they tested.
Okay.
And I know like what you're talking about, Mary knows, she's gotta find out, but how about them hard-headed guys that they show up and they're positive, they still show up for work and nobody over there knows? And what?
So,
I mean, we had some the other day, they're sitting there positive, they showed up for work, everybody else is pissed off because why they come back to work when we just finished testing and they tested positive? I mean, and nobody knew who was sick, but they were telling everybody that they came out positive, so that's all they knew.
so as far as the testing that we did for all the county employees on Wednesday. Wednesday, it was Wednesday. Everybody that came out positive before they left the EOC, they were told, you are positive, and we found out vaccination status or not. Go home, you to isolate for X amount of days. The vaccinated were told 5 days isolation, return to work after the 5 days, and we even told them it will be this day, and for the next 5 days after that, you will wear a mask, and you need to contact and notify your supervisor so they are aware that you are positive. Now, beyond that, we don't keep the results of those because it's through Texas Rapid, so the state generates the email and the text message for that employee to get their results. Now, I do know now that there were employees that totally disregarded the isolation and basically did their own thing. And so we're trying to figure out a way to also have those results in front of us. That way we can turn it into HR, because they have all the HIPAA classes too. So they are aware of who was positive and did not comply. I talked with Dr. Roth on that about, you know, what else can we do? And he's like, besides notifying the supervisor ourselves and saying this is what's going on, the supervisor needs to ensure their employee goes home and meets the isolation requirements. He and himself and myself, we both look at it as, with so many county employees and then general public in isolation, it is once again very hard to say, well, this person out of 100 tested positive, keeping track, of course we have a paper trail, but keeping track of every single movement of that person, that is going to be hard. It's just like back in when we started this in 2020. It is very hard to keep track of what an individual does.
It just makes it harder for everybody else. I mean,
It does, and unfortunately, you know, if that person goes and gets somebody else sick, then they should be liable for getting that person sick. That's my true feelings, in my opinion, because you're just blowing off everybody and doing your own thing.
See, depending if this thing keeps going worse, we may have to do another declaration, and then you could fine them or do what you need to do. But we got two parts of this. We got one is your public part, and then you got your employee part. On your employee part, if someone tests positive and fails to follow that order, that's reason for termination. And if we're going through EEOC guidelines on vaccination, they're saying, okay, you don't get vaccinated and you didn't meet ADA or any other requirements, you don't want to get tested, then goodbye. Because someone's going to have to pay that fine. And they're going to come after us. So those reasons for termination, the same thing with these employees, they need to understand if you test positive and you come back to work, put people at risk, you're not going to have a job here. You know, unless you make a reasonable accommodation, you know, for them, because you have to protect everybody else.
I totally agree with that. We have to protect each other, and it's just not about protecting the individual. It's also an employee goes back to work, exposes other employees, and then they take it home to their families. And what if they have an elderly family member that gets sick and ends up in the hospital? You know, yeah, granted that employee never got affected, the one that spread it, but it does travel.
See, so many people come and complain to you and you get frustrated because you feel like you can't do anything. And I know they complain to you and to you. But if we're getting people that are complaining because employees are going back to work or they're not doing what they need to do, okay, we can't directly get somebody in another's office to fire them. But we can wait till the end of the year in the budget and say, remember y'all didn't want to follow us, and you know what? You're going to lose a worker. Because someone's gonna have to pay that fine. And maybe we can take that action against that elected official. I don't know, there's a lot of gaps there. But you may have an employer or another elected official that doesn't want to comply, but I think right now, we have everybody on board now, wanting to comply. We just need to bring them up to date. But all you all together can settle and say, you know what, I can't do it together, but you know, we'll remember it, we'll take care of it, because then you're not taking care of your constituents.
I have a question for Chief. So I had a staff member who came out positive. She stayed home for 5 days, came back. I tested her at work. She was still positive, but a very faint one.
It's still,
She could
it's-
stay, right?
a positive is a positive.
So she could stay or she had to leave?
She has to leave because it's another positive test.
Even though it's been 5 days?
Is she fully vaccinated? So that's a,
Well, she's double vaccinated, not, she wasn't boosted.
so CDC now says a vaccinated person is defined as someone who is, number one, received a booster, completed the primary season of Pfizer or Moderna within the last 6 months. That means they're not eligible for the booster. They have their both.
Right, so that she felt like she wasn't eligible for the booster yet.
Okay, and then, of course, Johnson & Johnson. But we have to make that determination within the public health side. So we have to utilize the test that we're utilizing. So if she came over, we could test and say, okay, you're good to go or not. A lot of this is falling back on, just like the law that the judge was talking about, it has to be observed by a trained individual.
Right.
So that's where that comes from.
Well, it was her test, we just
Yeah.
wanted to make sure, I sent her home, but then she tested here the next day with y'all, and she was negative.
Okay, and then the whole thing, and this is something else I've been trying to tell all the county employees, that, because we've gotten a lot of phone calls over the past 7 days on COVID positives and return to work. The county policy until today has not changed, so anybody returning to work still has to get the 2 negative tests, official negative tests, and then come showing their proof of 2 negative tests to get a release from our office to take back to HR, and then whatever HR dictates from that point to return to work. Now, if the commissioners change that today, then it changes, but that policy is still the one that we are following.
Denny, so if they tested positive, they have to be up for 5 days, and to come back, they need 2 negative tests. What if they were just, let's say, the Commissioner Niave said, let's say they were exposed to somebody, they need what, 1 negative?
So
What would the rule be on that, if they were
So-
just exposed?
Exposure is,
Let's
okay,
say
are you vaccinated? So not vaccinated, we want you to stay at home.
Yeah, but we're assuming on everybody that's vaccinated.
Vaccinated, it's, you're good to go to work, monitor yourself for symptoms, it goes back to the self-accountability. Hey, I'm not feeling good, or I got a runny nose, I should probably stay home. And then we advise get tested again in like 2 to 3 days. That way to rule out, oh, yes, I was exposed, because it takes a couple of days
Okay.
to come in.
But Chief, I'm still, if we keep the policy of having those 2 tests, since they're so short with testing right now, will the county be offering those tests for county employees?
Right now, between the judge and what we've secured, we have enough to take care of the county employees.
Okay.
So like on that one, on the Commissioner said, let's say they were exposed, but they don't have any symptoms at all. They don't need a negative test because they never came out positive, or they still need a negative? They don't, unless
They start getting symptoms. We strongly recommend that after exposure in 2 to 3 days, come get a test.
get a test,
Yes.
and then it'll start back. If it was a positive, they'll come back with 2 negatives, and it'll be.
Unless the court decides to change that policy today. Because that is,
Because all our guys, they came and signed some timesheets Monday, and they found out, so today at 11, they went back and tested again, and everybody's still negative. I mean, it was just because they were around it, you know. They just want to make sure they don't want to be sick and go to the house or anything. But then I got one of the guys that work there, his daughter came out positive, so he called me yesterday, should I go to work? Yeah, he's got all 3 shots and everything. Yeah, you feel good? He goes, yes, just come to work and wear your mask and see how it goes. He's got to go back Monday and test himself again.
So I've been in touch with Dr. Roth. Dr. Roth couldn't be here. He's actually sick right now, not of COVID, with other issues. But as far as what his recommendations are, someone who is exposed and fully vaccinated, meeting those guidelines, the booster, or within the last 6 months, after quarantine, you need to wear a mask around others for 10 days, test on day number 5 if possible. If symptoms develop, get tested and stay home. Someone who is exposed and unvaccinated or unboosted, or been over 6 months since the completion of the primary, so the first 2 shots, and has not received the booster, stay at home for 5 days, test on day 5. After 5 days, if you have no symptoms, continue to wear a mask for 5 more days. If symptoms develop, get tested and then stay home for that period. For someone who is testing positive, stay home for 5 days. If no symptoms or symptoms are resolving after 5 days, wear a mask around others for 5 days. If symptoms have not resolved by 5 days, stay isolated at home for 10 days. And then, of course, if you do run a fever, continue to stay at home until the fever clears. So that's what Dr. Ross recommendations. He says, I hope this helps provide up-to-date information to the Salle County residents and keep everybody, the policy consistent.
After the 9th, where everybody has to be vaccinated, it's gonna change it a little bit. I mean, if you're positive and you're unvaccinated, you gotta be tested every week anyway.
So one more time, so by after the 10th, everybody's got to be vaccinated?
The 9th.
Well, yeah, by the 10th, everybody, so, but we need vaccination record, because how would Mary be able to reach and find out who had it, huh?
If they're not vaccinated,
Then they're gonna have to start getting weekly tests at their expense, and it has to be at a clinic or someone to watch over them.
And how much is a weekly test?
Huh?
How much is the cost?
they're running around $23 to $25 a test.
But they have to get it with the county.
It has to, no,
Professional.
it has to be at a clinic or something.
So we're moving at home kids?
Huh?
They can test at home?
No. They're gonna have to go to a clinic. We can put someone to watch it, but this is the thing, we've gone through a lot of expense to vaccinate people. So if unless they have an ADA condition, we're not gonna be testing them. You know what, they can cover the expense of their insurance or the doctors. Because we're gonna be using our time, you know, for their reasons.
Okay.
So I think that's fair. So unless it's ADA,
You think we should just follow CDC plans or put 2 different plans out there? Because some people are gonna want, well, CDC says this and then you got this. I think we should just continue with the CDC plan.
That, what
'Cause
Dr.
we'll
Roth,
you're gonna confuse a lot of people with CDC and then with this one, county putting that one out there.
what Dr. Roth emailed, that is per the CDC guidelines.
This is CDC.
Yes.
that's CDC.
And the CDC has been very confusing. I know for us, there was a CDC guideline for first responders, then we found a CDC guideline for teachers and students, and then a CDC guideline for general public. And it's like, well, we all kind of fall on all of the groups. Which one do you follow? It's been really confusing in the past.
Because the school has their own
Yes.
thing
And
going
then,
on.
This thing
We'll
is,
follow CDA.
yeah. And then TA is adopting, so everybody's trying to adopt portions that, in my opinion, are gonna benefit them to get their employees or people back.
Can we make copies of this?
Absolutely.
Okay.
So is your recommendation just to follow Dr. Rose?
Yes.
Leave policy?
Yes. I recommended, I talked to him yesterday afternoon, from what he could talk, and that is what he is recommending. And that way we're consistent with the most updated CDC, we're not doing anything different, and then it's a blanket across the board.
So are we gonna offer any kind of leave, something extra for our county employees?
No. No, it all costs quite a bit. They've had a lot of chances to get the vaccine, the
Well, I
vaccine.
would say for those that are vaccinated and do get COVID.
No, 'cause, I mean, we've taken a big loss in the expenses that we've done and the monies that have been down that we can't. We got to make a decision. Right, I mean, we
They need to stay
can,
safe, you know, instead of a lot of people going out everywhere now in San Antonio and everything, and, I mean, y'all just do the same thing, I mean, we gotta protect ourselves.
well, right now we just have the policy on the agenda. I mean, we can address it, but we got too many employees to go. And you have that state law that says your first responders and your law enforcement, detention officers are not gonna get any vacation days or sick days related to the virus or related to the virus, so we're already taking a hit there. People are tired, I know it felt good to have your mask off, it felt good to do things, and hopefully we can get back there. Hopefully we can get back there, but right now, you know, it's best to try to mask up. Danny has a plan that he can take for HIPAA, because some employees, when they get positive, they tell their bosses or they tell other people. Well, the HIPAA means that the employee, if he decides he wants to keep it confidential, you know, he has a right to keep it confidential. So, but, you know, we also have the right to protect our employees. So if they get a positive, you know, they have to go home, but we don't want to blacklist them or make them really look bad either.
So if they get a positive,
Huh?
if they get a positive, do we, the supervisors, have to contact HR?
Someone has to contact HR.
Who's the only people that are the supervisor and HR?
Yeah, and unless that person gets sick, give it in writing to someone to release it. Even though they told you, I wouldn't tell nobody other than HR because, you know, they haven't signed a release. And it's hard, but, you know, it has to be done.
And it's hard, because it's a small town, todos se esparramos de volada, like.
It is, and unfortunately, later on this month, the Department of State Health Services vaccination side is coming to inspect our vaccination program and testing program, and so all the HIPAA compliance and whatever. And so if they do start finding HIPAA violations coming from Mary's office, which I hadn't got to tell you yet, 'cause, our office, so forth, if that, they start finding per violation. So it starts getting really expensive if we start having those HIPAA violations. That way, even the supervisors, if need be, we're willing to do the HIPAA class for the supervisors. That way, everybody's in compliance as an employee tells the supervisor, they know to keep it confidential or something else is gonna happen.
Yeah, but what I'm saying, this town's too small, even if, as hard as you try to keep it confidential, it's not like.
As long
And
as
then
it,
fingers will start pointing, well, it came from there, it came from there, and
Yeah.
it's just a small town, it's gonna get out there.
it is, but as long as we can prove that it is not a county employee or like our office, Mary's office, or a supervisor letting that out, then it's not on the county getting the citations.
So, Chief, do you think that with all the cases we have, and they all some seem to be mild, is that are we developing herd immunity?
No, it's, what we're seeing is those with the 3 shots, so the 2 primary and the booster, will be getting the mild symptoms, milder symptoms. The 2 dose, if they've only had the 2 shots, they are getting it just a little bit more. But the unvaccinated, it's still hitting them the same way. So as,
Well, that's gonna be hard.
and as we progress, the vaccinated, it's going to
So
continue
there's
to
somebody
mutate.
noticed, this is.
It's not
use one of
going
my
to
employees
stop.
As an example.
So the more people we can,
Hey, no, you
get
look
vaccinated
for
with the
everybody.
boosters, and
Not my-
the less it's going to affect us. It's from
In our
one.
county yard, there's 20 employees.
Minors,
Hey,
unvaccinated.
Freddie, no venido.
We have done
And there it goes.
a lot. And that's part of the other thing I was going to let the court know. As of today, adolescents 12 to 17 years of age are recommended to have the booster shot now too. So it was approved for them. Last week you couldn't get except 16 and above. So now we can do the 12-year-olds. So hopefully we get a lot of the parents bringing in the 12 to 15-year-olds to get their booster. And that's how it's going to help us start slowing that spread. Anything younger than 12 is not approved at this time, so we can't do anything about that.
So we would need, we did the motion, right, to adopt the, Dr. Rowe's recommendations for leave related to testing positive by an employee.
I'll make a motion.
Second.
Okay. All those in favor say aye. On the second part of that, we don't need to take action on the new state law for first responders because it's state law, which is not taking sick leave or any type of leave from first responders. So we don't have to do that. Third, I know HIPAA's hard to follow, just try to keep it as tight as you can. If someone's not following and they let you know, then we'll bring them back in executive session. And an employer as well, and address it. I mean, or we can declare an emergency again, and then you can fine them. We can do 2 things.
Yeah, because the HIPAA at the county yard is gonna be super hard. I'm gonna use one of my employees as an example. Say Freddie wouldn't be showing up to work. Hey, why isn't Freddie showing up to work? We got precinct 1 and precinct 3 and 5 there, 4. Why isn't he coming to work? Está malo. He's sick. Right there, and then it's just gonna, hey, Freddie hasn't been coming, watch out.
Our department felt the same thing when the first firefighter tested positive. It was very, very quiet. I think 3/4 of the fire department knew before Gilbert and I knew. And because that's just like the county yard. Everybody knows everybody except the people that should know.
Yeah.
Well, there's been some cases, and I'm gonna tell you, give an example. Well, not an example, but things that I've seen, is that if we declare you can do the fine, but a lot of this has to do with the DA could get worse. Because if you got someone that's highly contagious and they go to nursing home, get some people and they die, they can be responsible for. And I think it's already come up in some cases where people have messed with the vaccines or people have messed with the food and they're contagious. And it gets treated the same way as, for example, if you're HIV, you stick a needle and you stick to them, it's considered an assault. And it can go to that level, but it has to go to the DA and people need to push it. Because if you know you got it, you could really hurt somebody, you could really kill somebody, and I think that's where we're all worried about it. But it's not a sin to get this, you can't say that Jack gave it to me or Nico, it's everywhere right now. It's everywhere, so by wearing your mask, washing your gloves, because we're in a meeting right now, you can step in or step out. That's the best way to fight it. So it's serious enough, and every small town's having to deal with the same issues, but we've got away with not having to find people, and right now people, well, I didn't get that sick, so I'm gonna go out. No, you need to realize that you can still hurt somebody. You gotta think about the other person. And you're gonna have a lot of power to let us know, or let the sheriffs know, or somebody know that, hey, these people aren't staying home.
My only other question for the court is, we secured a lot of test kits for the county employees. Right now, just getting a test is very hard. We are helping out the clinics with test kits as they need to help the community also.
How many do you have right now?
I would have to do a count after what we've used between Wednesday and today. Because we have a lot, we've used a lot.
The South Texas just asked for more.
Okay. We can probably get them another box.
So, I'll tell you what happened. Nationwide, there's no test. TDM can't get them. The only reason I was able to get them because we use Vitamin. And what happened with Rolando, that he entered into a contract last year with Abbott, the company Abbott, to buy 500,000. So he has some bids with the school district to do. So he told us he'd sell us 2 cases, about 12,000, and he provided these extras. So, and these aren't, they're individual, but it only comes with one little bottle because it's only for doctors, only for EMTs. The home kits you have come with a little liquid. So this one has 40 in each box, and you gotta test them individually, so you can't really hand them out. They have to be provided by a medical provider. So, but we need to let them know, do we want more than 12,000 or we want more? Because in your jail, every shift you gotta do it. Fire department, you have to do it. Sheriff's office should be able to do it, every shift. So people are having to test more than one time. You know what, I got exposed again, there you go get tested. So we go through those real quick. We can easily go through 6,000, 7,000 a month.
I know on Wednesday, we utilize between 800 and 1,000, just on Wednesday.
On Wednesday?
Yeah. So it's a short supply and they're expensive. But right now, there's a nationwide shortage of them. And that's why I say wear masks, wash your hands. If you're sick, get them to stay home because it'd be less testing that we have to do.
Mm-hmm. And what one of the things I want to ask the court or let the court know is, right now, the test that we have on hand, granted, South Texas Rural Health will make sure they get another case. But after Wednesday, word of mouth must have got out. because we're getting people, family members from San Antonio or other places, hey, can I come get a test? This morning, we started getting phone calls from people that live in Mexico, seeing if they can come here, and I said, nope, it's for county employees only at this time. So if anybody gives you guys a call, I just want to let you guys know.
I would say that for county employees, whatever locals you determine need to do it.
Or LaSalle County residents, case by case, but if you're not.
They don't have a ID that says LaSalle County, Cotulla, or Ensenada? No.
Because it started all of a
So the
sudden,
driver's license, they tells you where they're from.
yeah.
Every Wednesday, Walmart restocks, just in case you want to tell somebody.
Say it,
Every Wednesday, Walmart restocks with the vitamins now.
if they're getting them in stock, I know,
They are, because I buy them every Wednesday.
okay,
But you gotta buy them when they give them to you.
No, I don't buy them.
yeah. Because I know in like Laredo and San Antonio, CVS, Walmart, HEB, and Walgreens, they can't get tests,
And
so,
the Walmart that restocks every Wednesday is the one in Arizona.
yeah.
So how much are you paying for yours?
They were $14.95, now they're $19.
For one, for
And
one.
there's
Well,
two tests in,
$8.
Yeah.
And it's 6, a limit of 6.
Danny, how about them? Are you gonna start giving the vaccine again?
that's what I forgot to say. Monday morning at 9 a.m., we start vaccines again. We had
For kids also?
for kids also, just with 10 firefighters out, it put a little bit of a strain on us, and I didn't want to risk any more spread within the fire department, so we halted until we started getting the staff back, but we will be good to go on Monday.
For ages 12 and up.
For the 5 to up,
40.
5 to however old. And we have Pfizer, the pediatric Pfizer, and Moderna, so we can do it all.
And these are boosters?
Boosters, first dose, second dose.
You got to do it at the EOC at the fire station.
At the EOC. We're gonna keep everything there. The guys finally moved into the fire station, so it's a little easier for us to control everything at that area and clean it and not expose the fire department too much to, more and more people.
Mr. Mendez, on Monday, from what time to what time can you give out shots?
It is 9 a.m. to 6 p.m. Monday through Thursday, and then Friday will be 9 a.m. to 4 p.m.
And Saturday all day?
We don't have anything for Saturday.
Going back to the policy, and it's gonna be kind of strict, but I want to make a motion that if someone did not test last week and does not give you information that they tested, that they're to go home until they get tested, and, you know, Margie and Mary will have the right to give them that note to go home. Well, I mean, that has to be the case. I mean, we have to have it somewhere.
And the fire department is going to provide all the names to Ms. Bettis?
Yes. And if the employees have the little email they sent them,
But the supervisor-
then we can send it. What he can do, he
Why
can
don't you
create
do that?
a little email. Jorge, you can create an email to submit medical information for Mary, huh? Yeah, I mean, Ricardo. Yeah, if you could create an email that says, okay, county medical, information or confirmation. And we just forward our email to that, and then everybody has the same email, we use it over and over and over again.
Judge, and we can keep track starting right after this meeting,
Yeah.
but all the testing we did on Wednesday, that's why we had to get each individual email, because it gets sent to the employee. There is no way we can get into that system and retrieve who tested or who didn't. So that will be whoever tested on Wednesday, the supervisors or the employee will
That's what
have
I'm
to get it
saying.
to
It's
me.
better you let know their
We
supervisor.
may want to retest next week then,
Okay.
everybody.
We can do that too.
Why doesn't the supervisor just text her or just email her the name? Hey,
Because we hadn't decided on a policy yet.
I had an employee who tested negative. She got an email saying she tested positive. So she called your office back and they told her there was an error.
Yeah.
Because that's the only email that she got, was the one that said she was
And,
positive.
yeah, and unfortunately, we have to use our cell phones, and with the, it's just two big buttons, and if you just touch, yeah.
And like I said, if they want us to turn in those emails to Mary,
Mhm.
one of them is going to say negative.
And
But she wasn't.
everybody knows the scheduling was really late that evening, getting everything coordinated. But next, if we do another one, it will be a lot easier, because then we'll be able to space it out and not have such big groups and more organized. But this was put together really quickly.
Yes, overnight.
Yes.
I'd asked Mr. Shaughnessy already a couple times to give me the language and the policy to formally implement the federal law that becomes effective on the 19th. But I do know that for those that do not want to get vaccinated, they will need to get tests on their own.
There's also another one that is being written right now. It has not gone up for vote, but it is saying if any first responders, which would be peace officers, detention officers, EMTs, firefighters, if you are not fully vaccinated, you can no longer work. So, just so where we still have some employees in that category across the board that have refusing to get their vaccine or do not want it. They're not refusing, they just don't feel they need the vaccine.
what if it's a
Was
county
that-
official?
No?
It's not there yet, I'm just saying that's the way it's being written and presented, so that might be another bridge we have to
But
cross.
what if it's a county official? And they're not vaccinated, they don't want to get vaccinated?
I think it's not the problem anymore. I think everybody's complied already. I think everybody's complied. So, at this point. So they had some county officials that chose to get vaccinated this week.
And actually, we had a very good, during the testing process, we had a lot of county employees, after the test, they said, can we get our shot?
Yeah.
We weren't doing shots, but I figured, well, hell, we're already exposed. If there was something wrong, let's draw some shots. So we did a lot of vaccinations on the same day. So it was
So-
really good.
So I think everybody's on board, which is good. Because we can't fire a sheriff or a tax assessor or a commissioner for not taking it. You know, everybody else is vulnerable. But, and that was a question to Shaughnessy, well, if an elected official refuses to take it, then we get fined, you know, what does that create? But everybody's on board, everybody's taking the shot, so we're good.
Está bueno.
I don't have anything else to say.
For the discussion of county policy approval, I make the motion. That's for the fire department first responder.
Well, that's law anyway,
Yeah,
that's law, but I'll second the motion anyway, and we will implement. Huh?
Do you all want to discuss next week?
It's gonna be easier, right? It'll get easier. Huh?
Same time that we did last time?
I might adjust it a little bit, give us, so we're not all stacked on each other.
The only thing is, I do know that you're gonna have to open some testing to the public. You're gonna have to open some up to the public. And I don't know when Mr. Casares will get that pallet but we're gonna have to open some.
What if a family, I'm just gonna throw this at you, what if a staff member comes out positive, can they bring in their family that they live with to test?
I think we've tried to accommodate people off and on depending on what it's done. And I think we've been reaching out. It just, I'm gonna leave it up to him on a case by case because if it's a vaccinated person and everybody's vaccinated, you know, you're gonna treat everybody the same. When they're positive.
And really, even with the fire department employees, pretty much the way we went home, like my son, my husband is sick. So we want him. They sound sick. Guess what? We're not even gonna worry about testing you because
You're probably positive.
you're positive. Just say, don't come in.
So I would rather test them all together like the 5th day, whenever they're supposed to come back.
So when do you want to test?
Next Wednesday.
Next Wednesday.
Okay, we're gonna have to, because I heard that y'all did real good in the morning, but after lunch, everybody got showed up together. Okay, so, okay, you got a lot of time, you can schedule with everybody, and, okay, because that's what I heard.
And we're gonna start earlier too. Yes, yeah, I'll do a schedule and get it out. Seriously, when we did last Tuesday night, I sat there with a notepad.
I mean, they said in the morning it went real good, but then after lunch, everybody just showed up and everybody was all together. So that's just what I heard.
I misjudged some of how many people that afternoon group, and everybody in the afternoon said, oh, right at 1 o'clock, would be the best time.
We were in
Okay.
and out. We were in and out.
And the test we're using, it takes about 15 minutes total, but, and then I also forgot some county offices, because I was trying to remember at that time at night.
I know that Laredo, the school Laredo, what they do is they brought a certain amount of kids into the cafeteria, they sat them down, and they gave them the test kit, and said, okay, put it up your nose, turn it around, put it in your nose, put it down, all together, and then somebody came with the drops, boom, 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 and they did about 100 of them all within 15 minutes.
Yeah, but over here, they ask for driver's license, the kids don't have driver's license.
But I will say, since we started doing this with the fire department, when we had a lot of the positives, and we're like, you know what? Everyone's gonna get tested and so forth. We have yet to have another positive case. So it took about a week and a half of a lot of tests and nosebleeds later for us, but we stopped it within the department. So Wednesday was awesome because we identified a group. Next week, we do it again, and I think we'll stop that spread, the rapid spread. So it worked out very well.
What's that?
Adjourn.
No, we got minutes?
So that's a different one, huh?
Yeah, it's an addendum. It's still in the same meeting, it's just an addendum. We don't have to close and reopen.
There's 3 of them, she got some in the mail right before this. All 3 of them in December.
Yep.
Are all three what?
December.
He came in.
All right. Did you read them?
Yeah, she's right in the middle of Christmas.
Yep. I make the motion to approve the minutes as presented.
Second.
All those in favor say aye.
Aye.
All those opposed, same sign.
Holidays.
The one in the back is last year's, and on the top is the proposed. And I have for you the full amount. The only one I added was that Juneteenth, which was exactly what I had last year. Was the other part.
All right.
And here's the calendar for the one that the dates. Just the dates.
I'm gonna keep this. We got one right? Yeah, we are gonna take this now. Righty.
What was that Juneteenth for? Juneteenth or Juneteenth is?
Juneteenth, that's the one that I had last year.
For what? What is it for?
What was it? I don't know, something.
If he goes for that.
Freedom or something.
Mm-hmm.
It was added last year.
What?
It was added last year.
Ah, bueno, porque ya, ¿te acuerdas?
New Year's Friday and Monday. All right. Thanksgiving, the whole week, está bueno. Wednesday through Thursday and Friday.
South Texas tested 70 yesterday, and they had 9 positives. All symptoms. They had symptoms.
Okay.
So it's pretty prevalent in the community right now.
Pay, no pay, pay, no pay.
You're looking at the dates, paydays, you look at paydays?
Yeah,
I'll make the motion to approve the 2022 holidays.
So
The same amount of days, no? It doesn't-
are you giving us more holidays, Marjorie, the same amount of days?
Same amount of days, I think I'm done it right.
Okay. Make the motion to accept the holidays as presented. Is there a second?
Thank you.
All those in favor say aye.
um,
All those opposed, same sign. Monthly reports?
Miss Mary, on the Christmas holiday, Thanksgiving, can you check cuando cae tu payroll?
Ah,
So we could plan ahead of time instead of.
that, and, Ms. Maldonado said that they're gonna work on a committee to have planning for the holidays, for Thanksgiving and Christmas, right? So they're all gonna work on that ahead of time, that way it's easier for us
Plan.
to plan,
That will be for Thanksgiving.
and Christmas.
And Easter and Father's Day. Well, at least for Father's Day.
And it's, Christmas.
That'll work.
So is there a motion to adjourn?
Mr. Motion?
Well, did everybody turn in a report?
Except Constable 2,
Huh?
Constable 3, Sheriff, Election Administration,
It's a
and
little early because the deadline is the 6th, right?
5 EMS.
We got table.
Table. I make the motion to table the report.
Is there a second?
Second.
Make a motion to adjourn.
All those, well, is there a second?
Second on.
Jackson just.
All those in favor say aye.
Aye.
Okay, it's good to have a little friction. It's good to have a little friction. No, I,